really a measles outbreak anywhere in the world is driven by two things. You have people who are susceptible, largely because they're unvaccinated, and then you have the introduction of measles virus into those communities. And so when we see increasing measles cases globally, like we're seeing now, we're going to see increased cases here in the United States too, because there are still individuals who are not protected. And where we get the outbreaks are where there are clusters or groups of people who are susceptible to measles.
It's clear that children need to be protected. What about adults? How much of an impact is measles among an adult population?
Yes, that's a great question. And measles certainly can be a problem in adults. It usually happens in areas where measles virus transmission has gone down, so people aren't exposed to measles virus, but vaccine coverage wasn't really, really high. So children kind of make it through their childhood years without getting either vaccinated or exposed to measles virus, and then you've got susceptibility among adults. And so in some countries, we are seeing this kind of widening of the age distribution of measles cases, where it's not just a disease of young children as it traditionally was, but we're seeing measles cases in older children, adolescents, and even in adults.
What can be done at this stage?
I think one of the most important things is what we're doing right now is to talk about measles, to tell people that it's still a serious public health problem, that we're seeing increased numbers of cases around the world, and that this is really driven by low vaccine coverage. So we need to have vaccine advocates, vaccine champions, who really are out there speaking about measles. We have some very difficult settings where it's just difficult to vaccinate children in, for example, conflict settings or fragile settings where the immunization systems are just not strong enough. We need to help build the resilience in those communities and help to support those immunization programs. So at the International Vaccine Access Center at the Johns Hopkins Bloomberg School of Public Health, we're working to try to get the messages around measles out. We're working to try to identify characteristics of those children, those zero-dose children, and those missed communities where we really need to focus in order to achieve measles control, measles elimination, and then hopefully global measles eradication someday.
What does a measles vaccine look like?
Measles vaccine is really one of our best vaccines. It's one of the most effective of our vaccines. So it is administered as a shot, as an injection or jab. The World Health Organization recommends that all children receive 2 doses of a measles vaccine, and almost everyone who gets 2 doses of a measles vaccine is protected. The protection depends in part upon the age at first vaccination. So when the measles vaccine is given at 9 months of age, as it is in many countries, maybe about 85% of children are protected, and that's why there's a second opportunity or second dose of measles vaccine that's recommended. If it's given later in life, in the first year of life, say 12 to 18 months of age, maybe 95% of children are protected. With 2 doses, it pretty much protects everyone for their life.
Until vaccines reach the last child, what can communities do in the meantime to protect themselves? What would you advise people to do?
You know, communities need to kind of assess what the challenges are in their specific community. Is it a problem with access, getting the vaccines, and then, working with their governments and their local governments and community organizations to make sure that all children have access to vaccines, and then addressing on the demand side, making sure that caregivers and parents understand the value of measles vaccination, and that this is an important thing to have their child vaccinated and protected against measles.